Alright, let's jump right into it. So it has been 6 months in the OR working as a surgical nurse. By the way, please ignore my voice. Coming down with something, I don't know, but I'm gonna make it work. So it has officially been 6 months and I freaking love it. I do two things. I circulate and I scrub. I'm going to explain the differences between the two in this video. I'm going to hit on a couple of topics that you guys may be wondering about. So first and foremost, how I got a job in the OR, the roles and responsibilities of a surgical nurse. I'm going to talk briefly about some of the most common surgical procedures that I've seen. And last but not least, team collaboration. So some of you guys may remember I worked briefly in the NICU and I had gotten a couple of offers from different hospitals to work in their respective NICUs. So one particular hospital, I still had the contact information for one of the HR representatives who had spoken to me and had given me the offer. So I ended up reaching out to her and I explained to her that I was interested in working in the OR. So of course I was kind of embarrassed at first reaching out to her because it was one of those situations of like, I know you offered me a position in the NICU previously and I refused because I ended up accepting an offer elsewhere. However, can I please speak to your manager for the OR? But at the end of the day, you cannot be afraid and you cannot let things limit you from doing what you want to do in life, and you cannot let fear or embarrassment or any of these other negative emotions stop you from trying to achieve what you want in life and doing what is best for you. So I decided to go for it and she was very kind. She was like, yeah, we actually do have a few positions open. And then a few weeks later, the manager in the OR reached out to me and invited me in for an interview. So I interviewed and I believe a week later I received an offer. I'm not going to go into too much details right now about what made me stand out in my interview. If that's something that you're interested in, just let me know in the comment section below and it is something that I'll definitely make a more detailed video about. So that's how I got the job. I just decided to go for it and reach out to the HR representative and I got the spot. And with that being said, I'm going to talk about the sponsors for this video, which is Incredible Health. Incredible Health is this company that helps nurses get hired in 20 days or less, 100% free. And the best part is that they also help new grads find residency programs in hospitals in different units. So if you're a nurse, all you have to do is create one profile and they help you with the rest. They help you schedule interviews, they help you update your resume, and they help you find a job in a hospital in a particular unit that's best for you. And the best part is that you get support from current active nurses that help you through the whole process of job searching. Even if you're a new grad, they will definitely help you find new grad residency programs, and if you are already a nurse with experience, they can also help you find a unit that's best for you. What makes them unique from other companies is that instead of you applying to jobs, you create your profile and these hospitals apply to you. All you have to do is basically put in the locations that you're interested in working in and they will find all of the hospitals in those areas and match them to you. So if you're a nurse with experience who's interested in Incredible Health, just check out the information down below. I'll leave some info there and a link where you can find more information. So if you're interested in creating a profile, I'll leave a link down below that you can click and it'll take you straight to their website. I was honestly so happy when they reached out to me because this channel is really about sharing as much information with all of you nurses and nursing students, and this is my way of giving back to the nursing community. I've always been a huge advocate for nurses and I always want to help you guys as much as possible, and I truly believe that Incredible Health is one of those companies that, you know, value nurses and want to help nurses with their nursing careers. So I am sharing this with you because it is definitely an amazing resource to help you in your nursing journey. Okay, so back to my journey. This is what my orientation looks like. I know every hospital is different, every orientation timeline is different, but my particular hospital has a orientation for new hires for 6 months, and it is a huge trauma center, which means that it has been jam-packed with information. So in the very beginning, I started with general, GYN, and GU. Then I rotated through ENT, OMFS, and plastics. Then I went to ortho, and that includes everything ortho, so like podiatry, hand surgeries, trauma ortho, oncology ortho. Then I went through neuro and vascular, which is where I am right now. Next is going to be robotics, and eventually I will be learning about trauma, liver, and cardiac. So far, my favorite ones have been neuro and vascular, as you guys have probably seen on my social media on Instagram. So nurses either circulate or scrub. I am doing both. So let me first start with the circulator. Circulators run the room. You literally run the room and you are your patient's advocate. You have to remember that the patients are intubated and they are asleep. They cannot talk for themselves, they cannot fight for themselves or advocate for themselves. So you are taking that role of advocating for the patient. Your priority is essentially to keep the patient safe throughout the case. So in the very beginning, you are preparing the room. You prep everything. You are the one in charge of bringing the trays to the room, making sure that you have all of the correct trays that are needed with all of the instruments that are needed for the case itself. And usually in this part, you are tag teaming with your scrub person to make sure that all of the instruments and equipment and supplies that are needed for this case are in the room. You're prepping the entire room. You're bringing in all the equipment that is needed, all of the machines, everything. Even the bed itself. There are different kinds of beds for different surgery procedures, and you have to make sure they have the correct bed. Nothing is worse than you preparing the room, they bring the patient in, they intubate, sedate the patient and everything, only to come to realize that you have the wrong bed. So once the patient comes in, the circulator will interview the patient, and the interview consists of you are reviewing their name, their date of birth, if they understand what procedure is being done, if they know the laterality of the procedure, so are they operating on the left side or are they operating on the right side. You review any allergies, any medications that they're currently on. Did they eat for the day because they were not supposed to be eating that day? Do they have any contacts in their eyes? Do they have any loose teeth or dentures in their mouth? You also ask them if they have any metals in their body. And this is very important as a circulator because once the patient is intubated, we are in charge of putting a grounding pad on them, and we cannot put the grounding pad on any body part that has metal in the area because it can burn the patient. So after you interview the patient, you transfer them from the stretcher to the actual surgical bed. You strap them in with a safety belt so that they don't accidentally fall off the bed during surgery, because sometimes during surgery the attendings like to move the bed in different angles, so you don't want them sliding off by accident. After that comes intubation, and you have to stand with the anesthesiologist while they're sedating and intubating the patient to make sure that everything goes smoothly. After the patient gets intubated, this is where everybody preps the patient, and they prep the area that's going to be worked on. At this point, usually the residents are in the room, the attending might be in the room, and they are cleaning the area, they're scrubbing the area, and the scrub tech is usually there present, already scrubbed in, and passing off like sterile towels or sterile drapes, making sure that everything is being done sterilely. And you're kind of basically helping everything move smoothly. You know, they can't touch anything in the room because they're already sterile. You're unsterile, so you're the ones basically grabbing those extra supplies that they might need and opening it sterilely for them so that everything goes smoothly. And last but not least, once everybody's scrubbed in and everything is prepped and everything is ready to go, we do a timeout. And the timeout is when the nurse basically presents the case to everybody in the room. We review everything about the patient. We go over the patient's name, date of birth, the surgery that's going to take place, any allergies, what medications were given. We basically go over everything and make sure that everything is correct and that everybody agrees to everything so that we are all on the same page before we start the surgery. Throughout this whole part of the case is when you are also making sure that everything is sterile. You are watching everything like a hawk, because if anything gets contaminated, you risk infection, and we do not want any infections on our patient. After timeout is done, the surgery begins. You are going to be documenting, which is a lot of paperwork, but you take that opportunity to document everything, and you're also grabbing any extra supplies or equipment that they might request during the surgeries. And that is like a very brief description of what happens and what your responsibilities are as a circulator. But trust me, there's way more that goes into it, but this is just like a brief overview. Now, as a scrub tech, or as a scrub nurse, there's also a lot of responsibilities in that aspect. Like, you have to know what trays, what supplies, what equipments, like what will be needed in the surgery. Like I mentioned before, you are going to tag team with the circulator to make sure that everything that is needed is in the room. So you prepare the table, you open the trays, you prepare the table with all of the equipment and the supplies that are needed. Once the residents and the attending come in, you help gown them. And then throughout the surgery, you are the one in charge of passing instruments. If they inject any kind of medication into the patient, you have to keep track of how much is injected so that you can tell the circulator, because then the circulator has to document that on the computer. You have to keep track of where all of the instruments are, because you don't want to accidentally leave an instrument in the patient. Sometimes there's a ton of trays and you have to keep track of every single instrument. We have to keep track of instruments, we have to keep track of all the towels, all these little things that we have to keep track of. And as a nurse, I'm actually doing both of those roles. I think I like to scrub more because I feel like I am a part of the surgery itself, which is really cool because you get to actually get in there and see what's going on and what they're doing, and you're assisting in that. Something else that the circulator and the scrub tech or the scrub nurse are in charge of is specimens. Sometimes the residents or the attendings will take a sample of something and they want to send it off as a specimen to pathology to check if there's any like cancers or anything like that. You have to make sure that you are collecting it correctly and sterilely in a specimen cup, that you are writing the name of what it is on the cup and you're keeping track of what each specimen is. So that way when you handed it off to the circulator can then document it on the computer so that it can then get sent to pathology and everything has to match. Okay, so the next part is patient care. And one of the things that entails is providing comfort. Sometimes the patients come in and they're very scared. You know, the patient might come into the room and they might start crying. I've seen patients who are babies, I've seen pediatrics, I've seen adults and even geriatric patients, and they all react differently. It's your job to provide comfort. You know, sometimes patients, all you need to do is just hold their hand and they appreciate it so much. Just last week, there was a patient who came in and he was a Spanish-speaking patient and he was so scared. Just being next to him, just standing next to him and holding his hand and speaking to him in Spanish, and being the only Spanish-speaking staff in the room was really comforting for him. He really appreciated like just holding a patient's hand and reassuring them and listening to their concerns. You know, that all it goes a long way. They really appreciate it. And just little things too, like when they come in, you know, the OR is a very cold environment, so as soon as the patient comes in, I love to go to the back and grab some heated blankets, and they always appreciate that. You know, it's always the little things that go a long way. Realistically, this is one of the hardest moments in their lives, and you are a part of that, and they will remember you. It's like that saying goes, like, people don't remember what you say, they remember how you make them feel. You want to make sure that they feel heard and comforted and supported. Okay, surgical procedures. So some of the more common procedures that I saw were, for example, laparoscopic appendectomies or lap appies. If somebody's appendix gets inflamed, that's like a very common thing that happens to people. It's a very common procedure. It's very easy to treat. Same with a lap chole. I've seen a lot of hip replacements, knee replacements, GI things like people having a colon resection, gastric sleeve, breast reductions, breast implants. Those were pretty common as well. Yeah, those are pretty common ones. In terms of like the more complex ones that I saw, I believe they were all in neuro. I love neuro. Seriously, I love neuro and I love vascular. Oh my gosh, like I like scrubbing in them though. That's the thing. I like being a scrub nurse in those cases. I think the most interesting case was an aneurysm. Seeing on the screen the aneurysm like so swollen, and then once they clip it, seeing it like just shrink. I don't know, it just blew my mind. Like, whoa, like we are treating an aneurysm. And like in that moment when he was doing that, it was actually very tense in the room. Like that's one of those moments where like everybody's like holding their breaths because anything wrong can cause like a huge bleed. Oh my god, I don't know, it just blew my mind. Like it was just so cool. The OR is seriously amazing. I'm gonna keep saying it because I just love being in the OR. Alright, last but not least, team collaboration. So there's a lot of people who you're going to be talking to on the unit, and one of those people are the PSAs or the perioperative service associate, and they're basically the ones helping you bring some of the equipment over into the room. There's also obviously the attendings, the residents, the fellows, the interns, the anesthesiologists, the CRNAs, the anesthesia tech, the scrub nurses, the scrub tech, the board runner, the managers, the reps. On the phone, you're talking to pre-op, you're talking to PACU, blood bank people, you're talking to pharmacy. There's just so many people that you are going to be talking to, and it's so important that you communicate efficiently and understand who to reach out to depending on what you need. So you need to be able to voice things. You need to be able to stand firm and be strong for your patient. You need to be confident enough to talk to attendings who may, not agree with you, and you still have to stand up for your patient. We're all working together. We're all, on the same page. We're all communicating, and at the end of the day, our main goal is to make sure that everything goes smoothly and that our patient is safe. So yeah, that is everything. This is basically a brief overview of what my job has been like so far the past 6 months, and I am super excited. I love it so much. If you guys want me to make any other videos about the OR, anything in detail about the OR, just let me know in the comment section below, and I will definitely talk about it. So anyways, with that being said, I hope you guys like this. If you enjoy videos like these, please give this a thumbs up and leave some comments in the section down below letting me know what you would like to see more of. And once again, my name is Ivy. I love making these videos for you guys, and I hope to see you guys in the next one. Bye!